My name is Boris Malyugin. I'm professor of ophthalmology at Fedorov Eye Microsurgery Complex in Moscow, Russia, and I'm specialized in cataract and cornea. There are several to be mentioned. Definitely optical biometry is one of the things that revolutionized the IOL calculations, so we are having now much more precise measurement of the anterior segment. Also, I do think that devices that can measure corneal curvature, anterior and posterior, based on Scheimpflug technology and OCT technology, are also very useful, specifically in improving the outcomes of toric intraocular lenses. We do have some diagnostic tools that we use intraoperatively, such as intraoperative aberrometers, that also help us to manage challenging cases and improve our efficiency in selecting IOL power. I believe that these are the major advances that really make a big change in cataract surgery. With the surgical devices, we also have a lot of trends during the last 10 years, starting from IOLs to down to phaco systems. If we are talking about phaco system, there were some newer power modulations that were introduced, such as transversal ultrasound or OZIL and elliptical ultrasound that help us to reduce repulsion and improve the efficiency of lens removal. With regard to intraocular lenses, in 2007 there were first introduced trifocal lenses, which is, I believe, now is a standard of care for treating patients with presbyopia and improving reading abilities of the patient after the surgery. Also, we are now using more preloaded lenses, which is also, apart from convenience, it's increasing the safety because there is a less risk of mismanagement and contamination when we're using this type of lenses. Talking about new optical implants, these are pinhole implants that help us to enhance the depth of focus, and basically the whole new category EDOF lenses, which with the enhanced depth of focus, are with us now. We know that our patients now are using more and more intermediate distances with all these screen devices, portable devices, iPhones, pads, and so far and so on. So the previous dominance of near vision is now moving a little bit away from the person towards the intermediate distance, so that's why we need them. Talking about surgical devices, we have to mention femtosecond lasers that are with us for 10 years. And in spite of the fact that these femtosecond lasers are raising a lot of controversies with regard to the regular uncomplicated cataract surgery, I do think that it is the technology, first of all, that is progressing. It's on the development now, and also it is help us to manage difficult cases, such as patients with low endothelial cell counts, high density of the nucleus, zonular weakness, when we have struggling with capsulotomy. So there is a good place and a good future for that technology as well. There is always challenges in patients with comorbidities, patients with complicated situations like small pupil, weak zonules, loose capsule. So these are challenging not for only novice surgeons, but also for experienced surgeons. So we do have to use special techniques and employ different devices that help us to manage these cases. The other thing is that we still are not perfect with the IOL power calculation, specifically in very long or very short eyes, or patients with previous refractive corneal procedures. So this is also the area when we need to be more precise and more aiming to the emetropia, to the goal of emetropia. Also, I think we still, in spite of the latest development of posterior corneal curvatures and all these newest sophisticated diagnostic devices, we still have some way to go with regard to precision of calculations of the toric lenses. And one of the options would be probably to modify the optical power of the lens, which is located inside of the patient's eye, whether it would be with ultraviolet light or with a laser. I think that is probably the next major breakthrough in the technology in effectiveness and precision. This Congress was huge, and of course, you cannot even imagine to be in all places at once, and there are different very good corneal sessions outlining the latest advances in lamellar corneal surgery, which is the major advance in corneal transplant procedures, from both deep anterior lamellar keratoplasty to DMEC, descemet membrane endothelial keratoplasty, and also the newest technology of injecting endothelial cells and avoid any keratoplasty, but rather do this cell therapy to improve the vision of the patient. I believe there were a lot of interesting cataract sessions as well, with various topics, including femtosecond lasers, newest IOLs, and also astigmatism management. I love 3D live surgery. That was quite interesting and very visually attractive. We're now using 3D systems in our operating rooms, and I think there's a big future in that technology as well.